Hi, everybody. I'm so sorry that it's taken me so long to get back to you. It has been rough, really, really rough. I had my surgery. It's a week and a half ago already, which blows my mind. I can't believe it's that far out. But it was a really rough um, recovery. And I don't know how much of it was like the surgery itself, and how much of it was the cancer, but I progressively in like every single day, it was just getting worse and worse to the point where like I couldn't walk around the house. I had to have Trevor being like a motorized hand pusher for me to even get up the stairs. So it's been really rough. However, I will tell you that the last 2.5 days or so, I have been feeling so much better. And it's not just like the pain. Like I started my ivermectin and mebendazole about 5 days ago, and it's kind of lining up with what's going on. And I feel pretty good today. I'm so thankful just to be feeling more like myself. Like I have more energy. I feel stronger. So we'll see. We'll see if it continues going down that road. I'm also moving pretty far along on just the plan for all of this. So I met with Germany today. I know I'd mentioned that there is this thing called dendritic cells, where it's a type of cell that they kind of are like the conductors of all of your cells. And so in this hospital in Germany, what they do is they go through your blood. They take a bunch of blood from you, and it's not going to be a very formal description, by the way, but they find like these dendritic cells, and they look like little spiders, apparently. And those are the cells within that blood that then they teach those cells to recognize the cancer cells that are in your body. So, and what they do is once they get, a few cells on board, then they basically like multiply those cells. And then once that process is done, they then inject all that blood back into your body. And so then all of those cells, and it's like 1 million cells, will start recognizing those cancer cells, and they start attacking them. And the really cool thing about this is that even down the road, when you have those dormant sleeper cells, which all of us have, I've learned, once those kind of wake up, those cells that are still in the system and multiplying will recognize any sort of cancer cell that mimics the same cancer cells from before. So it's pretty incredible. It's pretty fascinating. So it's possible, you guys, I could be going to Germany in less than a month, because he said, the sooner that we can do this, the better. Then it's just going to be a matter of what next. I'm on, obviously, the ivermectin and mebendazole. I met with a holistic group, like a naturopath, this past Monday, and that was wonderful as well. They had me on a whole regimen of, different herbs and supplements that apparently, like, my body is very lacking. They did a lot of tests. They ran a lot of tests. And it turns out also I had Lyme's disease as a child. Who knew? Who knew? And what's crazy is like all of the things that it says with Lyme's disease absolutely line up with everything health-wise that I've experienced. It's pretty insane. And then you ask, like, well, how would anybody know unless you were testing for it specifically? So it's been a really great couple of days. I feel like I have a plan. I feel more, I feel just positive about the direction I'm going. I will say I'm going to continue needing your help to reach out, and please pass that GoFundMe along, because this surgery, or not surgery, but this procedure in Germany alone is going to wipe out that entire fund. So it's going to be a lot. It's going to be expensive, but I am 100% on board. So if you guys wouldn't mind just passing it along, like continue, if you haven't posted it on your page, even if you can't donate, what you can do is pass it along, because there will be other people that will be able to help, because I'm going to need as much as I possibly can. After this entire kind of Germany thing, I'm then probably going to get a second opinion from Freidert. I want to see if there's a way that they can remove the big mass in my pelvic region. because I don't want to do radiation. I don't. I think I mentioned that before. But yeah, this is kind of a long one, but I had a lot of updates for you. I'm sure I'll be back tomorrow or the next day just to kind of give you some more information. But just now, checking in. Thanks, everybody, for just following along. We'll keep you updated.